Hey everyone, it's Dr. Jen, board certified pediatrician and parenting expert. And today we're going to be talking all about the measles. I'm sure that you've been hearing about it in the last few weeks. There's so much information out there and concern on the internet, on social media. You may be hearing it from your pediatrician and your friends, and other new moms may be speaking about the measles outbreak and what you should be doing. Should you even be feared or concerns about the measles? Most people know it's a virus, but may not know the severe complications that can happen with the measles. So we'll talk about that today. I also want to talk about travel and obviously the measles vaccine, when you should get it, when your child should get it, and anything that you should be concerned or look out for. So there's a lot to talk about today, but I really want to help allay your fears by giving you all the information you need to know about the measles and the measles vaccine. So let's get started. So first of all, I want to talk about some couple of tips that are really, really important for you to know as a parent. So first of all, measles is extremely contagious. It's not a little contagious, it's extremely contagious. How contagious? Well, if you go into a room with someone who has measles and you are unimmunized or you haven't had the disease in the past, you are at 90% risk of getting measles from them, just from being in the same room as them. And you know what? You don't even have to be in the same room with them at the same time. If they entered the room and they've left, and you come within 2 hours of someone with measles in the room, you can contract measles. It's airborne. And that means that it's from droplets, and they can get into your nose or your mouth, your eyes, and you touch your face, all these ways that you can enter into your system. Also, if you touch something that they touched in the room, again, you can get it that way as well too. So it's extremely, extremely contagious. Also, you need to remember is that you're contagious 4 days before you even have any symptoms. So think about that, 4 days before you even have any symptoms until 4 days after the rash comes out. And I'll talk a little bit more about the whole course of measles, but 4 days, that's a lot. So you may not know, you could be walking around, going to the supermarket with your kids. Your child could be at school, they could be in daycare, so they can be spreading it to other people unknowingly, right? And so that's how it really spreads, because there's this big 4-day window. And also the incubation period for measles is 7 to 14 days. So you may not even know that you have contracted it until 14 days after your initial exposure. So again, that's how come it starts to spread. Also, I think parents may not know, but measles is extremely serious. And people sometimes think, and you may be hearing from others, that, oh, it's just a childhood virus. You know, they get viruses all the time. It's a fever and a rash. Well, first of all, it has very high fever, 104, 105. And I can tell you, as a pediatrician, seeing so many parents, that people freak out when their child has fever. Not only as a child also can be really uncomfortable at high fevers, but also they can become dehydrated if they're not drinking as well too. So fever can really be an issue. The other symptoms of measles are runny, watery eyes, conjunctivitis, sore throat, coughing. They often get these white spots in the back of their throat, which is sort of a sign that the rash is going to come. And they get a full-blown rash starting on their head and neck that goes down their chest and their back and their arms and their legs. Red spots that can also, some would be raised and coalesced or come together in clusters as well too. That the child, again, usually looks and feels pretty miserable. But really what makes it worse is the complications of measles. And so it can, as I said, be really, really severe. So what do I mean by severe? Well, first of all, the common complications, let's talk about that first. Common complications of measles that many children get are ear infections, they get dehydrated, and diarrhea. And so again, that's really not fun. 1 in 4 will even be hospitalized for complications of measles. So that's a lot. 1 in 4 may be hospitalized. So other complications, and the most common severe complication is pneumonia. About 1 in 20 children get pneumonia from measles, and it's the most common cause of death from measles, pneumonia, so secondary pneumonia. And I think it's also important to know that 1 out of every 1,000 child who gets measles gets something called encephalitis. And if you don't know what that is, it's inflammation, swelling, infection around the brain, and that can cause convulsions, which are seizures, and it can also cause long-term problems such as deafness. It can even cause intellectual disability down the road. can be quite severe and dramatic. So I think it's important, and about 1 to 2 children out of every 1,000 die from complications from measles as well too. And I think that's just important to know, because again, this can be totally prevented, and we can talk about that as well too. The vaccine is really, really good at preventing the disease and obviously the spread. And that's sort of what we're seeing now, that there's still measles in the United States. And that's really my third point. Why is there so much measles now? Why are we seeing this resurgence of it? We really thought it was eradicated in about the year 2000. In 1963 is when the vaccine started. We started vaccinating people within the United States. But before that, there were millions of people who died each year. Millions of people who got the disease each year. And so now, right, we're talking handfuls or hundreds, and it's really decreased because of the vaccine. But you can still get in the United States, and that's really because, again, the vaccination rate has decreased. And when it decreases somewhere down to about 90%, then we don't have what's called herd immunity. And it spreads like wildfire is really what I'm going to say. It really can spread quickly. But also, there's a lot of travel outside the United States. So sometimes you think of just third world countries that have diseases like measles, but we're seeing such big spreads. We're seeing it in Europe, in Spain, and in England. We're also seeing lots of measles in countries like Israel. There's big outbreaks. And also, I just read today about in the Philippines, there's a huge outbreak, and in fact, over 55 children have died since January of measles in that country. So I think it's important to know that the disease can be brought into the United States, again, unwillingly, because the people don't even know that they've had it, because again, they can be spreading the disease for about 4 days before they even have any symptoms, before they even get sick and go to the doctor and know what's going on. So that's why it's spread throughout this country. Because of the decreased immunizations rates. So I'm pleading that it's so important to get your child vaccinated. And I think my last point is really just to tell you that the measles vaccine, it's safe and it's extremely, extremely effective. It works. You get 2 shots, you get one MMR, and then you get another one. And those 2 are about 97% effective. And that's really, really high. So that's great for this vaccine, because we can really prevent this childhood disease. And as I was saying, 3 to 4 million people each year in this country used to get measles prior to 1963, before we had the invention of the vaccine. And of those, 400 to 500 people died, and 48,000 were hospitalized for measles. And again, 4,000 developed encephalitis, which is that brain swelling that can lead to many sequelae and complications as well, such as permanent hearing loss, as well as intellectual and brain damage and disability as well too. So it's important to make sure that your child is vaccinated. Here in this country, we usually get one at 12 to 15 months and another one at 4 to 6. But I think it's really important to know, to speak to your pediatrician, that these 2 shots can actually be given within a month of each other. And that being the case, if need be, if you're in a high-risk area within the United States, or if you're traveling outside the United States to a high-risk area, again, even Europe is considered high-risk if you're going with your family. So make sure that your child is vaccinated. Even if you're going to one of these places and they're younger than 1, they can still be vaccinated, but after they turn 1, they still need their 2 regular vaccines as well too, the 2 MMRs. So make sure, if you have any questions, if your child needs the vaccine, please ask your pediatrician or your health care provider, so you can stay up to date and prevent your child from getting the measles, and to also help those around who can't be vaccinated for other reasons, either being too young or having cancer or immunosuppression. Again, we can protect each other and keep each other as well as our own children safe. This is Dr. Jen, all about measles. And if you have questions or comments, please go to my website, Ask Dr. Jen, and I will answer them there. Thank you and have a great day.